I rise in support of this bill because this bill is about whether New Zealanders can see a doctor when they need one. And it really is incredible because while the government is working to fix a health system that was left in a mess by the previous lot, Kiwis are waiting too long for GPs, and we're under no illusion about the scale of the job that needs fixing. We cannot be waiting so long for specialists. They cannot be sitting in emergency departments for hours, and that is the reality that's being faced. Now look, I have quite a bit of respect for Dr. Aisha Verrill's contributions in the Health Select Committee and what she gave in her contribution tonight. But really, I cannot believe what the Greens are saying. They are more interested in cultural box ticking than clinical outcomes. This is not a repeal bill, it is an amendment bill. It's in the title. They are focused on how many Māori words are in legislation and how many times legislation mentions te tiriti. But they are not focused on what really matters, which this government is, and that's patient outcomes. Patients don't lie awake at night in their hospital beds worrying about the arrangement of words, what comes first, pie order or healthy futures. They worry about whether their mum can get a hip replacement, whether their dad's heart condition is going to be picked up in time, and whether the care that their children need when seeing a specialist can be done before things get worse. And that is what this bill is about, Madam Speaker, putting patient outcomes first, because New Zealanders deserve better than what the previous government gave them. They certainly deserve better than the irrelevant filler that the Greens, Te Pāti Māori and the Labour Party jointly signed in their alternate view in their commentary for this bill. This bill makes sure Health New Zealand has a clear job to deliver effective, timely and value for money healthcare, not ideology and duplicative and more bureaucracy. It reinforces accountability with measurable targets and ensures infrastructure planning is a core responsibility. It strips out the clutter that has slowed down decision-making and buried frontline staff in paperwork instead of caring for people. That is the part that the opposition can't stand, because it marks the end of 6 years where ideology was baked into the health system. We scrapped the Māori Health Authority because dividing people by race delivered no measurable improvements on outcomes. Now we are continuing the job of restoring the health system that serves everybody. One of the most important changes this bill makes, Madam Speaker, is a renewed focus on healthcare infrastructure, because for too long infrastructure planning has been treated as secondary or even tertiary. This bill makes sure that Health New Zealand has a clear objective to provide and plan for quality, financially sustainable infrastructure. The Select Committee made changes that defines infrastructure clearly in this legislation, including buildings, facilities and land used for delivering health services. It removes any doubt about what Health New Zealand is responsible for. Because if we don't get infrastructure right in healthcare, nothing else works. We end up in situations, as the Minister spoke about, like the Dunedin Hospital, where infrastructure blowouts mean that things cannot get built. This is about making sure the system is prepared for the future and has the physical capacity to deliver care. And it's necessary and it's long overdue. Another important change is clarifying that Health New Zealand is bound by the same political neutrality obligations as the wider public service. And the committee made changes to ensure the new sections align with the Public Services Act. This bill makes it explicit that Health New Zealand, as a Crown agent, must uphold the public service principles under the Public Service Act 2020. And again, there has been a big fuss made about it, but really what we are making sure is that healthcare is focused on patients and not pushing political worldviews. Healthcare is one of the top concerns, Madam Speaker, for New Zealand and Kiwi families. People are still doing it tough, and turning around a system like this takes time. Kiwis are being left on waiting lists, worried about the future. They don't want more reports, and they don't want organisational diagrams that go up from the bottom and back down and spread around. What they want is to see a doctor. They want to have their surgery booked. They want treatment. They want a system that works, and that is what ACT is focused on, delivering and fixing what matters. As a government, we have pushed for practical outcomes. We have ensured more access to medicine. We have opened the door to more private sector capacity, and we are backing the healthcare system, because at the end of the day, Madam Speaker, it is that simple. We need a health system that delivers healthcare.